Like Chanel said, I've presented 3 times before to this group, once with Dr. Ann and twice with Jana, and we're excited to be back today. We're going to do a little bit different of a format and have a much more open discussion, so we have time to answer questions and help kind of figure out some different scenarios you guys might be facing. But just to give you a little history on myself, I graduated with a degree in organizational communications. So I am not a social worker. I'm not a doctor. I'm not a psychologist, but we have 4 children and we live on the North Shore. Our oldest is 20, and then Briar, who I will be sharing our experiences with her today. She is 16, almost 17 in September. And then Cruz, our son, is 13, and Ansley is 9. And then we have Pineapple, who is Briar's service dog as well. I entered the world of fetal alcohol spectrum disorder when Briar was diagnosed. She was diagnosed just before she turned 1. We realized what it was that she was struggling with. And then we got an official diagnosis through a geneticist when she was 15 months old. So fetal alcohol spectrum disorder was not anything I was even aware of or understood until we realized that it was going to be a part of our lives for the rest of our lives. And I'll share more about that as we get into the training. But ever since we found out about her diagnosis, we have been very involved in the FASD community. We lived in Utah at the time, and we were involved on a state level there with getting legislation passed. And then since moving to Hawaii 12 years ago, we have been involved with the Hawaii FASD Action Group, and then also, working to get legislation passed here. So that is a little bit about me and our story, but everything I'll be sharing today is from a parent's perspective. I believe that education and awareness is key for this. And so throughout our story and throughout the experience with raising our daughter, we have come to know and love so many other families facing the same trials. And so I've been involved with IEP meetings and state meetings and helping these families understand how to best give their children the support they need to find success. So I do have some stories that aren't as personal, that are from other families as well, but most everything I'll share is very personal from our home, from what we experience on a day-to-day basis.
Okay, so let me go ahead and share screen. I'm gonna share a little bit about me and get us started a little bit. I want to tell you that we're really happy to be here. We've presented here before, twice before, and once was with Dr. Ann Yabusaki, who is our founder of our organization. And so I've been volunteering with Hawaii FASD Action Group now for about 6 years. And it's all volunteer work. And we, in 2019, in 2020, sorry, we started the process in 2019. And then in 2020, we got our nonprofit status. So we're now officially an organization, and we're a small little organization, and we're all still volunteers, and we're looking to try to expand some of the services that we can provide in the community in the future. So I'm a licensed marriage and family therapist. I worked in the mental health field for 14 years. And in the beginning, or the bulk of my time in this field has been in community-based therapy. And then in 2019, I went full-time into private practice. But throughout this time, especially in community-based therapy or community-based treatment, I got a chance to know our founder, Dr. Ann Yabusaki, and she talked a lot about fetal alcohol spectrum disorder. And I found it very interesting. This was like more than a decade ago. But I was still a young clinician at the time, and lots to learn about lots of different things. But I did take note of it, but I went on and I carried on in my career. And but after so many years of doing community-based therapy, we met up again. I had a contract with Family Court, and so did she. And we bumped into one another, and she had asked me to come and join their volunteer group, and I did. And I started to make the connections. And now this is after a decade pursuing my career independently of anything related to fetal alcohol spectrum disorder, and then just kind of reuniting with Dr. Ann Yabasaki, the founder of this organization. And then I started to reflect on the last 10 years. And things started to make sense to me in a way that really puzzled me in those 10 years. And what that was is when people, when clients I worked with and they had a pretty solid treatment team, they had a pretty solid care providers, they had parents that were really working hard at trying to get their kids some support and working hard at trying to shift certain problematic behaviors. And yet the outcomes were not favorable at all. And I couldn't understand because I was trying to apply textbook knowledge to all of this, and it just wasn't working. And it's only in hindsight and in my work here with this organization that I believe that in some cases, perhaps a missing component is the team or the family or myself included just didn't know about this particular possibility here of fetal alcohol spectrum disorders and what that's all about. And knowing and having this information can influence outcomes in a better way than not knowing at all and trying to proceed sort of treatment as usual. And so I got involved, I stayed involved. I asked to be a part of the pool of presenters because it was the way that I was going to learn, is by presenting. And it was also the way that it was going to stay in the forefront of my mind. And I was going to use this information on a daily basis in my practice. And that's because if not, I would default back to my clinical training or the things that I originally learned about maybe behavior management, for example, like how to shift behaviors through maybe like rewards and consequences, contingency plans, things like that. And I would have stuck with that and it wouldn't have worked for some people. And in fact, could even make matters worse. So that's why it's really important to me. I've met a lot of great people along the way, and probably my best teachers are those that have fetal alcohol spectrum disorder. So that's a little bit about myself. And Tara, we're going to share I'm going to give a brief overview about FASD. So because we've been here before, for some people it might be new. And if you could put in the chat if you've been to one of the ECHO gatherings here where our organization has presented on FASD, if you could just drop that in the chat, then maybe we can kind of see and get a feel or a pulse for how much we can kind of breeze through perhaps the overview, and we can go straight into what we'd like to do, since this is our third time here, is we'd like to have a good amount of time for discussion and questions and whatnot about your work and how you see the information we've provided in the past and today, and how you see that sort of connecting with your current work or not, and we can have a discussion about that. Okay, so this is okay. Let me see. How are we on the chat? Do we have a lot of people who have
no one's responded yet, but if anyone can just quickly type in yes or no. Yes, meaning you've attended one of the FASD presentations before. Okay. I would say we're like at a 50-50.
50-50? Okay.
Around there.
Well, this is like just under 2-minute video. We've shared this before at the last one, and since it's about 50-50, I think it's a nice sort of way to get us started. It's our friends at Proof Alliance, and they made a little sort of infomercial about FASD, and I just think it's a nice way to get started, especially for people who haven't been a part of our presentation before. So let me just cue that up for everyone. Please let me know.
Writing's not that easy, but Grammarly can help. This sentence is grammatically correct, but it's wordy. And we used to smoke on airplanes, drive without seatbelts, use lead paint and asbestos. But then we woke up, looked at the facts, and as a society, we decided to change things. Yet so many of us still think it's okay to drink during pregnancy. We continue to roll the dice and risk fetal alcohol spectrum disorders, mainly because we're bombarded by misinformation, hiding the fact that drinking during pregnancy is the leading cause of preventable brain injury. That 1 in 20 first graders are affected by FASD, and that the effects are lifelong, irreversible, and there is no cure. It's time for the misinformation to end. It's time to bring the proof. And we have the proof. Lots of it. We're going to challenge those who tell us a little might be all right, because they're all wrong. There is no known safe amount of alcohol to drink if you're pregnant. None. That is a fact. This is the wake-up call. When you don't drink a drop, FASD stops. Let's come together, all of us, to prove to the world that FASD is 100% preventable. The proof starts now.
Okay, so that's a nice infomercial and a really good introduction.
Hey, Jana, sorry, I'm going to interrupt. Your volume all of a sudden went down really low.
Oh. Is that better? Is it better now? Better? Okay. Okay, so let me go now. So yes, I see Kelly, saying, wow, 1 in 20. And yes, so that's basically 1 in every classroom. And I'm gonna share real briefly. Like I said, I'm gonna do a brief overview, and the rest of the time will be devoted to discussion and questions. And we can kind of discuss that a little bit further here. So let me see, sorry. Okay, so I'm gonna take us here. This is our website. And well, first of all, let me say that fetal alcohol spectrum disorders is just that, it's on a spectrum. And so there are levels of the developmental difficulty and the physical and health difficulties that one might experience. And so there's different, I don't have the diagnoses on my slide for today. I can definitely provide that information for anyone who's interested. But just to know that it's on a spectrum and levels of the difficulties and delays will fall anywhere on that spectrum. So I'm going to bring us here to our website. This is our website. We just became a nonprofit in 2020. So it's hawaiifasd.org. If you look here, we post whatever is events coming up. And so we have some legislative action on FASD that we're following federally, but also that we were following this past legislative season locally as well. If you scroll down here, here's our Speakers Bureau, which Tara and I are part of, and that's what was being arranged for us to speak today. So you could click on this and learn more, and what you could do is submit an inquiry if you have your department or your program or a certain team for an individual or client maybe wants to get more information, that's how you would contact us to set up for us to be able to present. And we tailor the presentation to meet the needs, whatever that might be for your whoever would like the presentation. Getting involved, we always encourage people, if you're interested, we welcome more volunteers. There's lots that we do in different areas, and help is always needed and welcome. Support groups. So support groups are really that, aside from the conference that we offer every other year on an odd year. So we had one last year in September of 2021, which was great. Hopefully some of you got to join us there, and we're looking forward to planning for 2023, and we're starting that up now. But so aside from the conference that we do every odd year, we have two support groups. One is a parent caregiver group, and that is for parents of those who are parenting someone with FASD or any developmental difficulty. And then Tara can speak more about that later. And then there is a provider discussion group, and that one is for providers working with, or maybe we think we might be working with someone with FASD, so we know where to go and we know how to get resources, support, even emotional support, because it can be very difficult even for providers. And so those two groups meet every other month. And so we can share more about that later. And then also Whole Pili, which Tara can share about as well, which is another activity. Monthly, Tara, or is it bi-monthly, like every other month?
It is monthly, but like we just finished actually running a soccer clinic, and that was weekly for 6 weeks. So it just kind of depends on what we have going on for each season. But yeah, I can tell you that.
Yeah. So Tara can talk about that. That's really great. This is a place where those with developmental difficulties, children with developmental difficulties, can get together and have a place where they can be together and socialize and have fun and learn and grow together and feel included and important. I think that's probably the best part. And then, so we'll share more about that. I just want to highlight here, this is our organization's definition, our definition of fetal alcohol spectrum disorder. It's not that it's any different from others, but it's what we've chosen to include in our collective definition. So FASD encompasses a range of effects on the brain and body of the individual prenatally exposed to alcohol. FASD is a lifelong disability. Individuals affected by FASD display various challenges in their daily living and are often misdiagnosed and misunderstood. FASD-informed education and interventions are critical for individuals and their families. With full support and education, individuals with an FASD will achieve their full potential and lead productive lives. So that's pretty much what we try to do, right? We highlight that it's a lifelong disability. We also share that it is various challenges in their daily living. They're also misdiagnosed and people are misinformed about FASD. And we believe that education and interventions, FASD-informed education and interventions are critical for individuals to really reach their full potential and maximize positive outcomes as much as possible. So that's our website. Please take a look. Here, I'm gonna just share, if we can focus first on the left column. So the left column are a lot of the difficulties and delays that someone with FASD are born with. So the brain developing in utero oftentimes have these difficulties if you look at on the left. So the primary disability, and that is inconsistent memory recall, decreased mental stamina, so they tire very easily, maybe on the same task another person would be doing, difficulty interpreting and applying abstract concepts. Those can be things like, not money, but like a credit card, or forgiveness, love, freedom. impulsivity and poor judgment, resistance to change, inability to predict outcomes, inability to see another person's perspective, and the inability to recognize social cues. And then if you look into the right column, you see that because they were already born with these difficulties, all these secondary issues emerge that make it quite difficult. It just compounds on itself and makes it so difficult for an individual and their family. So some of the secondary issues that arise are mental health problems, poor academic achievement, inability to live independently, alcohol or substance use, problems with employment, incarceration or confinement, trouble with the law, and disruptive school experience. So you can really see that the issues will really span the lifetime and that they're very difficult in everyday living. And the prevalence and relevance of why we're here and why we think it's so important to talk about, as already mentioned, 1 in 20 first graders are affected by FASD, and we believe that's a conservative estimate. Those would be people or participants and their parents that were willing to participate in the study within a classroom, right? FASDs are at least twice as common as autism. The CDC in 2015 to 2017, this is reported. So again, we're thinking this is a conservative estimate, but 1 in 9 pregnant women drank alcohol. 1 in 3 engage in binge drinking. With the pandemic, there's been a 55% increase in alcohol sales. Sorry, this is since mid-March of 2020. And then almost 50% of pregnancies are unplanned. So these are just some statistics for us to share. This is why we believe it's so important, why we believe that it's relevant to all of us and all of our work professionally, and even in our personal lives, that we can be affected by FASD in one way or another. Diagnostic barriers, there's a whole lot of stuff to go into this, but I'm just really putting the main bullet points that everyone needs to know. It's difficult to obtain verification of alcohol consumption by a biomom, which is a pretty important part of diagnosis. It doesn't mean that it's not possible, but it's definitely it plays a big role in most situations. Invisible disability means it's often either misdiagnosed or underdiagnosed. I think it's like anywhere upward of 90% of those that have been affected by alcohol in utero do not have any visible physical features or markers that would indicate exposure, but they have the brain-based difficulties from birth that we mentioned in this column. There needs to be more awareness of FASD in the state. That's another barrier to diagnostics. And currently there's no comprehensive diagnostic team in Hawaii. Typically it's preferred, it's part of best practice. It's not always, doesn't always happen this way, but multidisciplinary assessments are ideal for building the best composite of how to work with an individual. So a pediatric neurologist, a psychologist to do neuropsych evaluation, speech and language pathologist, and an occupational therapist. I'm just going to really point out really briefly, again, just trying to build a basic definition here of FASD or what FASD might look like. If you see here, chronological age versus developmental age, the smaller or shorter bar in each pair is the the developmental age. And then the taller bar would be the chronological age. So we see that when our youth turn 18, where society says, okay, you're 18, now it's time to go off into this world. If they're typically at the developmental age of 12, we wouldn't say that to our 12-year-old. So again, a lot of difficulties these individuals are encountering, especially when you add on their misdiagnosis or undiagnosed at all, right? Some common strengths I want to be sure to mention. They're intense and determined. That's very common. Very curious, concrete, contextual learners, friendly, generous, loving, and loyal. Oftentimes really enjoy music, creativity in the arts, doing work on a computer with technology, very kind of hands-on and instant sort of input from that technology can provide, and then working with their hands and good with animals. And lastly, I'm going to end with this. Try differently, not harder. That's a very important little phrase there to really remember. It's not like because we're not trying harder on behavior modification techniques, for example, because those won't necessarily work, maybe in small situations and not very reliably so on a regular basis, but it can in some situations, but really it's about thinking differently and outside the box. Tara has lots of examples of that. So you definitely, I hope you have a lot of questions there for us to kind of discuss. But so with looking again at the two columns, so instead of having behaviors, the individual might be experiencing symptoms, right? So instead of resistant, perhaps, to doing their work, perhaps they're fatigued. Won't or defiant to can't, right? Not doing their work or not listening to the rules, maybe because they don't understand them or there's too many rules. Refuses to sit still. The alternative could be that they're under or overstimulated. Resistant or don't care, maybe they just don't get it. Lying, or confabulation, which is sort of filling the gaps in the story or my understanding with just sort of whatever I'm making up at the moment, kind of thing. So not trying to be deceitful, but maybe just some memory deficit, so they can't really fluidly recall everything that happened or what they think happened in a situation. And then doesn't try, perhaps looking at it instead as tired of failing. So just some things to think about. So we're going to get started now with the discussion. So please think of some questions. We have some as well that we can ask, but please, if you have any questions related to your work or experiences, or even about the information provided so far, so we can get a good discussion going.